Game meats such as venison, goose, and wild duck are often viewed as a cleaner or more natural source of protein compared with industrially farmed meats. They are typically lean, rich in high-quality protein, and provide meaningful amounts of iron, zinc, selenium, and B vitamins that support muscle maintenance, immune function, and oxygen transport. From a purely nutritional standpoint, these meats can look attractive, especially for people trying to reduce processed food intake. However, for individuals with gout or chronically elevated uric acid, game meats deserve careful scrutiny because their risks are often underestimated. One of the main issues is purine density. Wild and game animals generally have more active muscle tissue and higher nucleic acid content than farmed poultry or fish, which translates into higher purine levels per gram of meat. When these purines are metabolized, they increase uric acid production. In people prone to gout, this can overwhelm the body's ability to excrete uric acid efficiently, leading to elevated serum urate and an increased likelihood of gout flares. Compared with chicken or turkey, meats like venison and wild duck are more likely to push uric acid levels upward even when portions appear modest. Another factor is that game meats are often consumed in ways that increase risk. They are frequently prepared in rich stews, slow-cooked broths, or concentrated sauces, all of which can further increase purine load because purines leach into cooking liquids that are then consumed. Broths and gravies made from game bones and meat can be especially problematic, delivering a high purine dose in a form that is easy to overconsume. For someone with gout, this combination of dense meat plus purine-rich liquids can be a strong trigger for flares. Although game meats are lean, their leanness does not protect against gout risk. Uric acid production is driven far more by purine content than by fat content, so choosing venison over fattier red meat does not necessarily reduce the burden on uric acid metabolism. In fact, some people with gout mistakenly increase their intake of game meats believing they are making a healthier choice, only to experience more frequent or more severe gout attacks as a result. This can be especially confusing because these meats are often recommended in general nutrition advice for weight management or metabolic health, which overlaps with the population at risk for gout. There are also secondary concerns to consider. Game meats can vary widely in nutrient and purine content depending on the animal's age, activity level, and diet, making it harder to predict how a given portion will affect uric acid levels. In some regions, wild game may also contain environmental contaminants, such as lead from ammunition, which adds another potential health consideration, particularly for people who consume it regularly. While this does not directly affect gout, it reinforces the idea that frequent consumption may carry unintended consequences. From a practical standpoint, most people with gout or high uric acid are better off treating game meats as an occasional food rather than a dietary staple. Limiting frequency, keeping portions small, and avoiding these meats entirely during or shortly after a gout flare can help reduce risk. Hydration becomes especially important if game meat is consumed, as adequate fluid intake supports uric acid excretion through the kidneys. Pairing meals with low purine, urate-lowering foods such as vegetables, whole grains, and low-fat dairy may help blunt the overall impact, but this does not fully cancel out the purine load from the meat itself. For regular protein intake, safer alternatives for people managing gout include eggs, low-fat dairy, tofu, tempeh, legumes in moderate portions, and modest amounts of farmed poultry or fish known to be lower in purines. These options can provide sufficient protein and essential micronutrients without the same level of uric acid risk. When iron or zinc intake is a concern, plant-based sources combined with vitamin C or carefully selected animal foods can meet needs without relying heavily on game meats. In summary, game meats like venison, goose, and wild duck are nutritious and lean, but carry a higher gout risk than many people expect due to their elevated purine density and typical methods of preparation. For individuals with gout or high uric acid, the safest approach is to limit these meats, keep portions small, avoid them during active flares, and focus daily meals on lower purine protein sources that support long-term joint health and stable uric acid levels rather than short-term dietary ideals.